Hello, Shewa. How you doing? The fashionable midwife is here, live and direct. So if you have any questions, you can ask me. I made a post on Facebook this morning, and that is what I want to talk about. Sexual intimacy after delivery, after giving birth to your baby. When do you start having sex with your spouse? It's a very sensitive topic, and I would like people to contribute. Please come up, come up, come on. Let's gist. Oh, let's gist, let's gist, let's gist, let's gist. For a new mom, maybe you are batting your first child, or maybe you've had children. Sex is a very sensitive topic. It's not everybody that likes talking about it. So although things have really changed, people are more wiser, people are asking questions. And as a midwife, I'm here to answer your questions, you know, to tell you one or two things about sex during postpartum. Men don't joke with that, they know they joke. And if you are not careful, a lot of things may happen. You may be having issues with your husband, you will not be happy. So you need that. And I used to say that anytime you go for antenatal clinic, that you should always ask questions. It's very important. When you go to antenatal, there are so many things that we used to talk about, and most time you have a midwife, a particular midwife that you just love her, you love her teachings, you can open up to her, because it's not everybody that can discuss about sex openly. But if you are not shy, you are married, you are not doing it even if you don't tell people that you're having sex, that pregnancy has really bring you out that when she something. So for your marriage to be fine, for your husband to be happy, for you to be happy, sex is very important in your marriage and in your relationship. Then, talking about sex during postpartum depends on woman to woman. You can't say because Lagbaja did have sex maybe 2 weeks after delivery that it has to be the same thing with you. No. Right to sex varies from woman to woman. And there are so many considerations that you have to consider before you can say, okay, I am ready. I want to start having sex after delivery. You have to consider your health. You have to consider your emotional well-being, because we are different and we are wired individually. So what you can think is easy for you may not be easy for another person. So many reasons why some women fear sex even after delivery, especially the first child. Maybe you had tear, maybe you had episiotomy performed on you and it was sutured. Maybe it's still painful. Maybe when you sit, it's still painful. Maybe your lochia has refused to stop. Make sure you explain to your partner, and at least most, I know that most partner that are very understanding, that he will empathize with you, he will understand that you are not just ready for it now, but don't allow it to get into issues with your spouse. What I know we usually tell our clients is that if you deliver normally, maybe spontaneous vaginal delivery with no any tear, with no any episiotomy, with no any complications, you are okay. 4 to 6 weeks, you are good to go. I've heard of a woman that said that a week after delivery, that her husband approached her for sex. I didn't probe for that because it's a private issue. Just like I said, what work for me may not work for you. So do what work for you. It's just like marriage. When we women are discussing, what works in your home may not work in my home. So you have to be very careful. You have to tread slowly. Don't say because this one is working for her, it has to be like that for me. No. Know your man, know how you run your home, and never compare two marriages to the other. So just like I said that 4 to 6 weeks for a normal vaginal delivery is maximum that you can start having sex again. But if you had CS done, it depends on how your incision is healing and your general well-being. So some people may start 3 months or even 6 months. But I think by 6 months, everything should be okay. it still depends on your body. I know some women that they had CS done in the morning, by evening time, they have already started walking about the world. They have already doing so many things. Very strong women. So it depends on your body. And why we used to say that you should allow 4 to 6 weeks before you start sexual intimacy with your spouse is that you have to allow the cervix to close. You know, the cervix is where the baby's head passed through before coming out to the world. So that cervix, it dilated up to 10 centimeter that the baby's head can pass through it. So you have to allow, and it will be closing gradually during postpartum, with the drugs they gave you in the hospital, with your feeding well, everything, the cervix have to close completely. And you have to make sure that the lochia are stopped. The lochia is the bleeding that occurs during postpartum period. Some can take up to 6 weeks, some 3 weeks. It depends on when your own dried out. Because if you don't allow local to stop, it may lead to infection, because it's the debris of your uterus that is shedding that is coming out of your vagina. So it has to be cleared. It has to be very clean. It must not be smelling badly. The odor must not be offensive. So you have to make sure that your local are stopped before you can start having sex. Just like I said before, if you had tear or episiotomy performed on you, you have to take care of that place to heal very well before you can start having sex. I remember when I had my daughter, I am a midwife. My late husband was a medical doctor. So about 2 weeks after, I think I had a small tear and it was sutured. So my husband was not saying, báwo ni, how far? Ṣé ó ti heal? I was happy that this man was so caring. He's now use finger. I said, is it paining you? I said, no. Is it paining you? A first timer. I was a primary. That was my first child. I didn't know anything. So, oh my God. I want to go live on Facebook too. I just remember that I've not really. Uh, Hello, the fashionable midwife is here. Have been talking on YouTube, not knowing that I didn't press go live on Facebook, and I've been saying some things about the post I made on Facebook this morning on my page, talking about sexual intimacy after giving birth. So I've said so many things on YouTube, but I will just continue. I said that sexual intimacy depends on the woman that is concerned. So it's the right to sex varies from woman to woman. If you read that post, you will understand what I'm talking about. That you don't have to compare your body with another woman's body. Our bodies are different, and the way we respond to things are also different. So most time the consideration is that in the hospital, we used to tell them after delivery that they should, if you have a normal delivery, a spontaneous vaginal delivery without any problem, you are okay, no complication, no pain, anything, 4 to 6 weeks is okay. You can resume having sex with your spouse. But there are so many things we used to consider before we say that you should allow this. That within that 4 to 6 weeks, it will allow the cervix to have closed. During delivery, your cervix dilated up to 10 centimeter before the baby's head came down. So it has to close back, and it's a gradual process. You have to allow the lochia to stop. That lochia means the bleeding that used to come out from the vagina after delivery, and it's also very in women too. Some 2 weeks, some 3 weeks, up to 6 weeks, some people will still be bleeding. So it has to clear off, and this is to prevent infection. You can't be bleeding and be having sex, and you know your body is still, just like Yoruba will say that ara tutu, that your body is still cold, is still weak also. So it's very important for you to take all this into consideration. Then if you had a tear or episiotomy performed on you, you have to be very careful. You have to make sure that it was sutured, you have to take good care of it. You have to make sure that it's not infected, and you may be having some pain. So there's no way you can have sex with episiotomy or tear. You have to be patient until when it is well healed and your perineum is in good condition for you to have sex. So in summary of what I'm saying is that for a normal delivery, 4 to 6 weeks is okay. But in cesarean section or birth that maybe there are some complications, you have to stay up to 3 to 6 months. It still depend on that woman, because it's the woman that knows how she's feeling in her body. She's the one that knows what she's going through. She's the one that can explain. Yoruba people will say, ẹni tó bá wọ bàtà ló mọ ibi tó ti ń tà. That means it's you that is wearing that shoe that know where it's pinching you. So you have to put your body into consideration. Your emotional well-being is also very important. Some women, they may not be ready, psychologically. Maybe she's still tired from the stress of pregnancy. So many things that can make her to be scared to have sex, especially the new moms. So you have to be very careful. But if you feel that you are okay and you are dry, you can tell your partner to get a lubricant for things to be very easy for you and to prevent friction during that sexual intimacy. And you have to tell your partner to do it slowly. There's no rushing there. I am your wife and I'm not going anywhere. Do it slowly. That slow one self, the sweet pass. I'm a midwife. I no get shame. So, and if you are feeling overwhelmed, you are anxious, please talk to your midwife. And at this time, when a woman just give birth, she needs so much emotional support, both from her partner and the children and the people around her. It's very important. Then, after delivery, ovulation can set in few weeks after. Eh, just like I used to say, our bodies are different. So you have to think about contraception. You want to resume sexual intercourse with your husband, please go to your midwife, go to your family planning clinic and have your family planning done to space your children so that the stress will not be too much for you. So before your ovulation will resume, before your first period, please go and see your midwife for family planning. This is very, very important. So in summary, you can resume sex about 4 to 6 weeks if it's normal delivery and you are ready, you are comfortable emotionally. Always consult your midwife or doctor for clarity. Don't take things on your own. Don't do things on your own. Make sure you have a medical advice that will help you to heal well and that will make everything to go the way it is. And the truth be told, there is no rush, there is no need to rush. Your health and comfort come first. It's very important. Yes, sex is good for you, for your husband, for you also to enjoy, but please don't rush it. Make sure everything is okay with you before you do that. And I want us to normalize real conversation around postpartum recovery. It's very important. Healing is more than physical. You may think you have healed, but what about your emotions? What about something that is going on in your brain? What about a lot of issues? Financial difficulty, pain, instability. Maybe your husband just lost his job, and maybe there are some issues that you are going through. So postpartum is not about seeing a woman laughing or breastfeeding her baby. So many things may be going on with her that you may not know. So it's very important for you to support this kind of women so well that they will easily come out of that state. A lot of women, they go through postpartum depression. And that kind of a woman, she will always be looking sad. She will not be happy. Somebody that is not sad, that we are now calling her to come and have sex. No, 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 no. You have to take care of her emotional well-being, her emotional needs, and you have to seek medical advice in time so that it will not get bad. I think I have to stop now till I come again. I'm just trying to see how I will be doing this in my life because it's very important and what we are doing is also important. Thank you for joining me and God bless you.